Well, right now we're working on three things. The first is that we are trying to assess the situation of palliative care in Egypt. We're writing a report about this, and we believe that nothing has been written so far that is as comprehensive about palliative care. And I think it's really important in order to begin understanding the situation and how we can begin resolving it. The second is that we're working on a number of tools that would enable people to perceive palliative care and end of life as something that they should be prepared for, something that they should plan for, rather than something to escape from or to avoid. And the third is that we're trying to push for policy forms for law changes that would advance the delivery of opioids, of painkillers, and that therefore would provide palliative care to more people, because currently this is being highly obstructed by the current laws. I mean, this session, I've heard a lot of the fellows talk about their work in their respective countries, and it was really inspiring to see models that take this to the next level. For example, there is this virtual hospice platform that is really inspiring by how it makes hospice services available to people who can't even access it physically. So this, for example, is something that makes a lot of sense in my context. We've seen also another fellow who is working on an initiative to train primary healthcare physicians on the provision of palliative care, which for me makes a lot of sense, because death is something that every single physician faces with his patients on a daily basis. It doesn't have to be something that is only resorted to through a specialist. And generally speaking, the diversity in the people attending the seminar, the presence of people from the government side, presence of people from civil society side, is making me see how what makes the topic interesting for both sides and what brings them on the same table. And it makes it very easy to see which angle we can adopt in order to talk to government officials or to civil society. What makes them tick, basically. And this for us is very useful, definitely.